Struggling with knee extension after a knee surgery or knee replacement? Then this video is for you. One of my favorite things to do is to have patients actually put the cane on the same side as their surgical side. This can oftentimes help people get better knee extension with every step that they take. It allows them to really push into that knee extension compared to putting the cane on the opposite side, which is the way you're quote unquote supposed to do it. So here, check it out. So in this example, my right leg is the surgical leg, and I'll hold the cane in my right hand. As I step, you can see I'm able to really extend my right leg, or that surgical leg, really well with every step that I take. Now, compared to putting the cane in my left hand, I'm actually a little more uneven. I'm not quite as steady. I'm not able to push into extension with every step. So here's a good example from the front. Again, as I walk, the cane is in my left hand, and although I'm more stable, as I step forward, I'm not able to push, and I'm a little bit more off balance. Compared to putting the cane in my right hand, it really allows me to extend that knee back with every step that I take, getting that extension that we need.